Hey everyone, it is Kevin Henry, Editor-in-Chief for DrBicuspid.com. Thank you so much for joining us for another episode of the DrBicuspid.com podcast. Thrilled today to have on a dear friend of mine and a leader out there in our dental industry, and that is Dr. Bryan Laskin. Bryan, how are you, man?
Doing great. Thanks for having me on. Just love what you're doing, Dr. Bicuspid. We haven't talked about this much, but you're one of the few voices in the industry that just highlight what's going on. And so I think thanks a lot for having me on.
I appreciate that. We've got a great team here, and we've got great content, including what we're going to talk about today, and I'm really excited about it. So Bryan and I ran into each other at the recent Star of the North meeting in St. Paul, Minnesota, had a great conversation that we're going to get into in just a minute. But for those out there who may not know what you do in this industry and what you've done in this industry, I'm going to turn it over to you for just a second and let them know, who Bryan Laskin is.
Thanks. Yeah, first and foremost, I'm a dentist based out of Minneapolis, it's funny because this was the first time I think we ever saw each other in Minnesota. We usually see each other at other dental meetings, right? But so I grew my practices over the course of about 20 years. We had no less than 25% year-over-year growth for 20 years. Then I was on the leadership team at the fourth largest DSO at the time when I sold my practices, developed a lot of different technologies, which is kind of where I spend my time now. Currently, my main project is I'm co-founder of a company called Tooth Apps.
And I always love to pick your brain about technology whenever we run into each other, where it's a Dicoma or Star of the North or wherever it might be. That's true. I didn't even think about it. Last time we saw each other, you were in my home state. So there you go. We just swapped out. So anyway, one of the things that you and I were discussing was about HIPAA. And you made a very interesting comment to me that the P in HIPAA isn't being discussed enough. And to be honest, a lot of people may forget even what the P in HIPAA stands for. So can we just start down that road? Because some of the points you brought up to me were really fascinating about that.
Absolutely. And what I'm going to be talking about, I think it's one of those things where I get asked all the time, Bryan, why isn't anybody else focused on this issue before? Right. And what I like to point out is, I'm young, I'm old enough to remember the first time I saw a suitcase with wheels on it, right? It was in the 80s. You know how long people were lugging around luggage without wheels on them? And then somebody was like, duh, there's these wheels that we have on everything. And so this is kind of one of those issues. So let's break down the P in HIPAA, like you said. Most people think it stands for privacy because of this focus on the security rule and the privacy rule in HIPAA. However, HIPAA stands for the Health Information Portability and Accountability Act, right? So, the purpose of HIPAA is to have the core issue in the name, the P, is to have portability of data. And what that means is that information doesn't stay with just in one spot. It actually goes with the patient when they travel from dental office to medical provider, that we have that crucial information about the health. It's because everything we do, every procedure you do, you have to start with a diagnosis, right? And to get to a diagnosis, you can't just randomly pull facts out of the air. We have to have the information. And so this is the most basic part of healthcare, is getting access to information about the patient. And we are completely failing in our profession today. So that's the expanded version of what P, the portability, is in HIPAA.
Well, then I've got to ask you, why are we failing? Why do we still carry around our luggage instead of wheeling it?
It's the same reason people are lugging around luggage, I guess, without wheels on it for so long. That's the way we've always done things, right? And so to do things a different way, somebody has to pull their head up out of their loops, look around and go, wait a minute, we're missing something here. And look, the only reason why I think I was exposed to this, or I saw this, was with the multiple software companies that I've developed and worked with in the industry. Because if you're going to be developing a new innovative product, like we did with my last platform that now is a part of Vine, Opera DDS, we did a lot of paperless forms. Well, to handle the information in the practice management software, you have to be able to both extract information and write it back. Well, I hit the barrier, and then if you're an AI company, you have to get information and extract the information and place it back. And so if you're working with small technology companies, you realize that this is a massive issue, but it's as big, or I would argue a bigger issue, for our patients and for us, dentists, who have zero access to this data that is legally owned by patients. Let's start there, right? the electronic dental record information, hopefully everybody listening to this is educated enough to realize that the dental record information is legally owned by patients, and dentists, we are stewards of that data. So what that means is we're responsible for having this information be accessible to maintain the privacy and security of this data. And I think that the privacy and security of that data has been hammered home because there's obviously a lot of issues there. But what hasn't been, nobody's focused on is the whole P in HIPAA, which is the purpose of it. The privacy rule and the security rule are supposed to be in service of that information being transferable and accessible.
You know, one of the things that I was thinking about whenever we were at Star of the North together was that we talk so much about the oral systemic link. And it feels like that we are so focused on making sure our patients know that connection, and that we want to work so hard with the medical community to make sure that dentistry is respected. And yet this seems like a glaring piece of the oral systemic link that just simply isn't there.
Agreed. And, I first want to validate. I mean, I think the oral systemic linkages are crucial for us to focus on as an industry. I think that's makes sense. The mouth is not separate from the body. Inflammation in the mouth affects your systemic health. Mouth is a very early warning sign for the systemic issues in your body. And so, but what's called interoperability, or the connection of the systems, has been worked on with flawed execution, granted, in medicine for the last 20 years. But if you're a healthcare patient, which everybody is, you have access to your medical information. There's this big piece that's missing, and it's the dental information. And so that's what we're trying to solve. That's what I think the P in HIPAA is really about. It's not about getting a slice of the healthcare information. It's about the comprehensive, because obviously if you do believe that the mouth isn't separate from the rest of the body, we have to connect our systems to medicine. And first, that starts with connecting our systems in dentistry. Like, Kevin, you're very right that, we talk about being disconnected from medicine. However, have you ever thought about, if you refer a patient to an orthodontist, what information do you actually send that orthodontist? Crap is the answer. I mean, sorry, it's like nothing, right? You get a new patient, you get zero history. If you have a patient with a failing endo in your practice, if that patient's only seen you, the first thing you do is look at the history of that tooth, right? But if it's a new patient, you act like that information is not valuable or doesn't exist, purely because that's the way we've always done things. And that's not the case. We need that information, and today's the day we fix it.
So let's talk about fixing it then, because, I know that what you're working on is an option to fix that. But how quickly can we change our mindset about, and I'm just going to borrow your word there, the crap that we're giving to, referrals here? How quickly can we change that?
Oh, immediately today. Well, now we can. Now you're right. No, obviously I co-founded Tooth Apps, and we've developed technology to solve this problem, but it's a deeper root cause that we've been solving for the last 3 years. Going back to educating the industry, I wrote a book about this topic called Dental Disorder to kind of kickstart this whole initiative, I guess. And then we've been also working on standard development. So writing ANSI accredited standards, both for the American Dental Association, where I co-chair a work group on interoperability. And also I led the creation of another standard development organization. So we're basically writing the rules by which this information should be transferred. And this isn't unique too. We bring in all the other standards from medicine, for the data nerds like myself, HL7 FIRE, and we speak the same language as the medical community to make this, and really setting the rules through an open forum so that we can holistically solve this problem, not just create another data prison to lock people's information. Because starting off with the number one thing is just to realize this information is legally owned by patients, and they have rights that are enforceable with massive fines by the federal government that basically haven't been enforced because the federal government historically hasn't looked at dentistry for much enforcement, right? That's changing, frankly, as we talk more about this medical dental connection. Obviously, if we become part of medicine, which we, or if we become in the same conversation as medicine, which we are becoming, those federal regulations are going to smack our industry hard, because to date, they've not. And I think that within the next 12 months, there's going to be some serious fines laid out within dentistry due to the lack of data access. It's a big deal.
And I think, at its very basic level, it's important that patients have all this trust in dentistry that they possibly can. And I think if there's ever a sense that you're not helping me or you're standing in my way because I can't get my own data, then I think that that's where we as an industry have to look and say, we've got to at least knock down that wall, because we worry about patient trust to begin with every time they walk in our practice, much less when they walk out and maybe are referred somewhere else.
100%. And I talk to a ton of dentists, as you do, Kevin, and what I've seen is that there's a K-shaped curve going on. And by that, what I mean is when I got out of dental school, if one dental practice was growing 10%, maybe another practice was flat. That's not happening anymore. Practices are either taking off like a rocket ship or circling the drain. I mean, there's not a lot of people that are hitting singles anymore. You're either hitting doubles and triples or you're striking out. And I think that this is going to be a key factor. When patients understand their rights, the fact that they can go see a physician and then see their records the next, an hour later through a mobile app, why wouldn't they expect that from your practice? When they go home and you've talked about a $10,000 treatment plan, do you think they hung on your every word, or were they overwhelmed with what you said and they want to process that information by reviewing it at home? I mean, it's pretty obvious what the experience people are going to want to have, and it's available. It just hasn't been until now.
So talk about some of the things that you're bringing to market, some of the things that you've been working on to hopefully knock down some of those walls, please.
Well, sure. So the first is the standards we wrote, one called ODIN, the Oral Data Interoperability Network, which written through the ADA, which talks about how data is transferred within dentistry and how we connect a medical record to a dental record meaningfully. Second to that, we wrote a standard called THOR, Transferable Holistic Oral Records, which talks about how patients access their data. And correspondingly, what we've done is we've developed within Tooth Apps a way to connect every system in dentistry. So it doesn't matter what practice management system you have, what imaging platform, they all can, once they plug into Tooth Apps, we convert that information so they all speak the same language. And then what we've recently released is our patient application, which is called CAIR, C-A-I-R. And that's similar to MyChart in medicine, where medical patients have access to their electronic health records. They can message the office, pay their bill. You can do the same thing within CAIR. So your dental practices, your dental patients, when they log into it, they see your logo and colors. They can securely message your office. They can pay their bill. They can do online scheduling, get third-party financing, look at the intraoral photos and the rest of their dental records that they've had in your practice. And so that's really what we've been focused on for the last 3 years, is creating this ecosystem that then brings the patient into the conversation, which I think has been a glaring hole in our practices. Every restaurant on planet Earth just about has a mobile application. You can go online and order your tacos, or you can call them up, or you can go there, but they have a mobile app because that's the way people want to interact with businesses today. And your dental practice is no different.
Well, we as a society want everything right now. We want to be able to, like I said, order the tacos or get our health records right now. So let people learn where they can find out more about what you're doing, as well as, maybe ask a question or two.
Yeah, just go to toothapps.com. So toothapps.com. And all the information is there. If you look at the patient mobile application CARE, all the information is there too. And reach out. Love to talk to you.
We're going to make sure to have that in the show notes. And if you're reading this on Dr. Bicuspid, there's a link right there that you can click on, make it very, very easy. So Dr. Bryan Laskin, my friend, thank you so much for your time. And thanks for chatting with me at Star of the North about the P. I think that's important for sure.
Of course, if we do another one, we could call it the PP webinars, right?
Exactly. We'll definitely do that for sure. We've talked about crap and pee in this episode, so I think we're in great shape. No, thank you. I really do appreciate it, my friend.
Well, thanks for having me on. Appreciate it.
Absolutely. Hey, thanks to all of you listening to this episode of the drbicuspid.com podcast. It's important to know we throw around HIPAA all the time. Let's make sure that we're actually doing the portability, be part of that as well. Until next time, it's Kevin Henry, Editor-in-Chief, signing off, and as always, wishing you nothing but success.